Hi everyone, and welcome to another coronavirus update. We hope everyone's been well and staying safe.
Well, we're dealing with quite the situation here in Montreal and in Quebec, with the number of deaths and cases not seeming to be going down. And with more and more talks of deconfinement, we hope that everyone will be extra careful and do their part to mitigate the risk of transmission going forward. Now, for some reason, Montreal, many reasons, continues to remain a hotspot, with more than 60% of the deaths in Canada and our population being less than 25% of the population of Canada. So as of now, Quebec is rated the 7th deadliest place in the world.
Wow. And so we really just wanted to take this time to remind everyone that just because deconfinement is underway, it doesn't mean that the virus is gone. It really just means that there's space in the hospitals and in the ICUs for more patients.
Yes, and there's a lot of interest in antibody testing. That's got to be our most popular question these days. And some of you may have heard that Health Canada has approved one of the tests 2 days ago. Now that test is not yet available in Canada, so we're going to keep everyone abreast of the tests as they become available over the next few months, where the test can be done, what are the details. We'll keep you posted on that.
Right. And so I think it's a good time to maybe discuss not only what an antibody is, but what are the different ways that our immune system actually attacks different viruses. So we really have two lines of defense. We have the innate and then we have the adaptive immune system. So the innate immune system, that's really our first line of defense. It's the immediate response of the immune system to a foreign invader. Now, it's not very specific to the virus. It really just senses, okay, there's something in the body, it shouldn't be there, let's attack it. And so that's quite quick. It happens very, very quickly. And then over time, the body actually learns from this. And so with some complex downstream mechanisms, we actually develop a specific response to this virus, the coronavirus. And that's through the development of a specific coronavirus antibody. And now, once this antibody is developed, now we're entering that adaptive immune system. So the body's adapting and learning to fight against a specific virus. Now, there's some key differences between these two responses. So the adaptive immune system, that takes a bit of time. So it's not as quickly functioning. And usually that's really there for long-term wise. If we want to fight the virus again, then we have a system that's already built against it.
So to highlight that point, not everybody who's exposed to the virus actually develops antibodies, which makes things difficult. That speaks to the innate antibody system, that general antibody, that universal kind of response that the body has. If it's effective in the early stages, it can clear the virus and the body doesn't have a chance or maybe a need to develop that secondary antibody phase. So that makes things a little bit tricky in the sense that the patient may be exposed, but the antibody test could be negative. That's what we would consider a false negative. So it makes things complicated.
Right. And we've really only been dealing with this virus for 3-4 months now, so there is a lot of unknown. So for example, we're making the reasonable assumption that if we are able to detect antibodies, you do have some protective immunity, but what we don't know and what's critical is how long you have that protected immunity. So is it for a week, a month, a year? We really don't know, and that's where we're kind of hoping and waiting for more studies looking into that to give us that information.
So this reminds me, Dr. Liello, of the hepatitis B story. Yeah. So we have a lot of information on the hepatitis B virus. We have a vaccine. We know how many doses of the vaccine we need. We have blood tests that give us antibody levels. So above a certain level, you're well protected. Yeah. Then there's a middle zone of antibodies or antibody titers where you have borderline protection. You might need a booster. And then there's a level below which you need the full series of the vaccine. But that took us years to understand the virus first, the antibody second, the vaccine level, who needs it when, at what point, do all members of society require it or not. So right now, early in the game, we can't confidently say, okay, you're positive for antibodies, now it's okay to interact with your elderly parents. We can't tell you that it's okay to go out without a mask. We also can't say it's okay for you to have a party with other people who are positive for antibodies. You also can't make business decisions based on it. Like those who are positive for antibodies can now go back to work and those others need to stay home. Another twist in the whole puzzle, as time evolves, we're seeing more and more cases which seem to be legitimate of people suffering from coronavirus symptoms, recovering, and then getting it a second time. And it seems to be a legitimate second exposure and getting the symptoms again. So that's also concerning.
It is. And as with all of these concerns, we could really ask ourselves, well, what's the point of doing the antibody testing? Or at least what's the point of doing it right now, now that we're missing this information? And are we recommending for our patients to go out and get the antibody test done now? And the answer for us is really not really. We're not really recommending it right now. Both Dr. Oommen and I were family doctors, so we focus on the health of our patients at an individual level. And so, from the beginning of time, they always, the first thing that they would teach doctors when it comes to diagnostics is you don't order a test if it's not going to change your management or treatment. Right? So in this case, whether the result comes back positive or comes back negative for antibodies, nothing's going to change. We're still going to have to remain very, very cautious. We're still going to have to wear masks when we go out, be careful when we're around elderlies. So really nothing changes in terms of on an individual level. Now, you could see from a public health point of view, testing for antibodies makes sense because it provides us with a lot more information from the whole kind of population point of view.
Now that's true. From a public health point of view, the antibody testing might give us tremendous value and information. So it might give us a broader picture of who's been exposed in Canada, do they have antibodies, and how close are we to herd immunity. It may also help us with questions like who can return to business perhaps, how can we slowly reopen businesses, or public transit. How many people at any given time might be positive and not have symptoms on the metro. And that may also play to how many people can be on the metro at any one given time. So tremendous information from a public health point of view, which we see it as the next phase and value of the testing. But like Dr. Liello said, from a family medicine one-on-one case-by-case point of view, at this moment in time, that may not be that helpful.
Right, and it's true. So we have to also look at risks. So, right now, if the results aren't really going to give us, aren't going to change management, we have to look at the risks of going out and doing the test. So you're stepping outside of your comfortable environment, you're going into a lab where there might be other high-risk individuals there, and, that's risky. And you're also getting a blood test done, which, we normally consider as low risk, but there's still risks of bleeding, risks of infections. So it's really difficult to kind of mitigate that risk, given that it's not going to give us that much more information from the individual level. At the same time now, we're trying to tell people, especially with this warmer weather coming in, the long weekend, it may be more and more difficult for people to abide those rules and socially distance themselves because you want to be outside. And we do encourage that you do go outside, enjoy the weather, get the fresh air. But at the same time, we've tried so hard, like March and April, to kind of keep things up. It shouldn't be for nothing.
So I think it's clear, with the gradual deconfinement, now more than ever, we need to be extra careful. So as you're slowly leaving your secure, clear home zone, we want to increase protection and increase your guard. So as we decrease confinement, you want to increase protection, increase your guard.
Perfect. And so that really concludes our segment for today. As always, we really wish for you everyone to stay safe and best of health.